Welcome back. We're here with Dr. Sharon Hecker discussing high blood pressure. So far, we've learned what hypertension is and the negative health consequences it can have if not controlled. Let's now talk about what people can do to control it and some other important items related to high blood pressure. Thanks for continuing to be here with us. So let's talk about who has high blood pressure. Talk about the demographics.
Well, high blood pressure is very common in our society. Statistically, 1 in 3 Americans will suffer from high blood pressure in their lifetime, and that comes out to almost 75 million people. Blood pressure can affect folks at any age. Even young people can develop high blood pressure, and 95% of our high blood pressure is what's called essential hypertension, meaning that we're not sure why people have it. Their blood pressure just starts to go up and needs to be treated. There are a few secondary causes. That's the 5%, maybe due to a congenital kidney problem or something like that, but it's much less common than just plain old high blood pressure.
So what about lifestyle changes that we can take or make to help control high blood pressure?
Well, lifestyle turns out to be very potent. Just by losing a little bit of weight, no matter what your weight is, will help to lower your blood pressure. Exercise, regular exercise also helps lower the blood pressure. Paying attention to your stress level, so spending time doing relaxation, maybe yoga or meditation, that helps dilate our blood vessels and lower blood pressure. And then lastly, eating a diet that's rich in fruits and vegetables, high in calcium and potassium, and low in sodium or salt also helps to lower the blood pressure.
So how about talking more about exercise? So I'm assuming it's not just running marathons or doing, lots of aggressive exercise. There's some simple.
Oh, yeah, that's a good point. It could be any type of exercise. It could be going for a walk. It could be just going to the gym and doing some weightlifting or aerobics classes. It could be a yoga class. It could be swimming, bicycling, playing with your kids, gardening.
So stress, you mentioned stress, and you mentioned it as it relates to high blood pressure. Can you talk more about that? We all feel stressed, living is stressful. Talk more about stress.
Yeah, our bodies respond to stress by raising our blood pressure, raising our heart rate, getting us in that mode of fight or flight. And if we can find ways to relax, that will bring our blood pressure down. A really unfortunate sort of side effect of modern culture is that we are stressed a lot of the time. It's appropriate to be stressed if you're running, say, from a mountain lion. But if you're always stressed, if you're always feeling like it's life or death, life or death, life or death, your blood vessels constrict and your blood pressure goes up.
So I've heard about something called white coat hypertension. Can you talk about that? What is it?
Yeah, white coat hypertension refers to the syndrome of when a person goes in to have their blood pressure checked at the doctor's office, either with a nurse or a doctor who's wearing a white coat, their blood pressure will go up. That increase in blood pressure might be transient, so it might just occur for the 5 or 10 minutes that they're there in the doctor's office having their blood pressure taken. Or it might be a sign that every time they're stressed, whether they're in traffic or their rent check is late or maybe one of their kids gets in trouble at school, every time something like that happens, their blood pressure goes up. So we tend to look at quote unquote white coat hypertension as a flag that maybe a person has high blood pressure the rest of the time as well. For those people, checking your blood pressure at home is really valuable, and then bringing in a list of those blood pressures to your doctor along with your home blood pressure cuff can tell us if you really do have white coat hypertension or not. Another couple of things I'd like to say about that is that most of our trials where we look at patients' blood pressure and whether or not lowering it is beneficial use a office blood pressure. So it's the blood pressure that's taken by someone with a white coat. So we know that even if your blood pressure only goes up in the office, it might still be beneficial to treat it. So that's one point that I'd like to make. The other thing I'd like to say is that if you're really convinced that your blood pressure is only high at the doctor's office, is never high at any other time, or you think maybe it gets too low even at other times, we have ambulatory blood pressure monitors. So we can actually monitor your blood pressure at home for a 24-hour period and find out how often your blood pressure is actually elevated.
Wow. So what about alcohol and high blood pressure? Can you talk to us about that?
Yeah. Alcohol does raise your blood pressure, not right away, but after you've had a couple of drinks, a few hours later your blood pressure will start to go up. One of the ways you can lower your blood pressure is by cutting back on your alcohol intake.
Okay. So other recommendations you might make for our readers who are either concerned that they might have high blood pressure or they know they have it?
Well, I think the first thing you need to do is be aware. So know what your blood pressure is, know what it tends to run, where you're at, and then how you feel. I'd also recommend taking an assessment of your lifestyle. Do you eat healthy foods? Are you overly stressed? Are you getting enough exercise? Maintaining your ideal body weight? All of those things are really important, not only to prevent high blood pressure, but also to treat it. Then the next thing I would really stress is that you need to have a good relationship with your primary care provider. And that should be someone, a nurse practitioner, a physician's assistant, a physician, that you have a good relationship with. The reason for that is there are many, many blood pressure medications. And if the first few that you try, like if you try one and it really makes you feel sick, or you try another and it doesn't make you feel good or it gives you a rash, we can just keep trying medicines until we find one that works.
Oh, great information. I want to thank our viewers at home for tuning in. Until next week, stay fit, stay well, and stay healthy with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.